In this presentation, we're going to talk about the healthcare interpreter's protocols. We're going to start by defining what a protocol is. Now, a textbook definition of protocol in general is a set of rules that explain the correct system, conduct, and procedures to be followed in formal situations. Now, basically what this means is that there are certain rules or guidelines for how to interpret. So how to perform interpreting tasks. So we've already explained and talked about what the responsibilities of the interpreters are. For example, we talked about the obvious language transfer, right? Listening to a message in one language and then communicating that exact same message, the equivalent message in another language. We also talked about the responsibilities such as being accurate, complete, making sure you don't change anything, ensuring participants' autonomy, and things like that. So now that we know what our responsibilities are and the tasks that we are going to complete, there are certain guidelines and certain rules of performing this work that are going to support not only accomplishing those tasks that you are responsible for, but also to ensure that you are performing these tasks at the professional level. Protocols also help define the interpreter's role, not only for the interpreter themselves, but also for the other participants in an encounter. It helps you communicate through the way that you practice. The guidelines and the practices that you employ in order to do this also help you establish your boundaries and define your role for the other participants. To explain this a little bit better, let's start looking at the protocols for interpreting. The first protocol we're going to discuss is the professional introduction. You will sometimes see it called a pre-session in some of the resources and study materials for interpreters. I like the term professional introduction because it serves as a way to introduce yourself as well as your role. The professional introduction is basically a way to let both the provider and the patient individually know who you are, what your role is, your responsibilities as an interpreter, but it also gives them instructions on how to make the encounter as smooth as possible with the interpreter present. So in a sense, it's a good way to communicate that difference that exists between someone who is a family member or is not trained and someone who is trained. That freedom that offers, which means that patients can feel free to share things as they wish and as completely as they wish, knowing that a professional is going to be listening and completely interpreting everything they say as they say it, without judgment, without sharing or taking any information outside of the room. And the providers can feel more comfortable knowing that the professional interpreter is going to have the skills required to actually communicate medical concepts and terminology that someone without training would lack, and not missed like it might be with someone who does not have the note-taking skills, the memorization skills, and the vocabulary skills necessary to actually interpret appropriately, accurately, and completely. Okay, so on screen, we see the guidelines for the professional introduction. And so just to be clear, a professional introduction ideally needs to be done with the patient, so between the interpreter and the patient, and between the interpreter and the provider. So they both need to receive information from the professional introduction before the encounter begins, before they start addressing the visit or the appointment for the patient. Now, later on, we will talk about when the adequate time and how to do it when to do it and things like that. Right now, let's concentrate on what should be said, so what the professional introduction should include. On screen, you see the first piece of information listed is the introduction. So basically, this is you identifying yourself. Your name. If you are an interpreter who is working from outside of the clinic or the hospital, if you, for example, work for a third-party vendor or a company the hospital or clinic contracts with, you should then introduce yourself with your name and the name of the company you come from. If you work for the hospital and you work, for example, for the interpreting services department, then you can introduce yourself saying you're from the interpreting services department. The next part is confidentiality. Now, here you see that I have written it as confidentiality/notes. So confidentiality, this is where you are going to let the patient know about your responsibility to keep information private by HIPAA. Now, of course, you're not going to mention HIPAA because the patient may not be familiar with the name of the law, but you can actually be more explicit and let them know that anything that is discussed within the appointment is going to remain private. Now, the reason why I include notes there is because sometimes we also may need to take notes as we are interpreting. So another way that information can leave that room, another way that we can accidentally spread their information is by leaving notes around where somebody else can see them. So what you should mention is that if you do take notes, that you are going to be careful to make sure that they do not leave that room, or the information within them does not leave the room, so that any information isn't inadvertently shared with someone else. The next part is short sentences and need for breaks to allow for interpretation. And this is where you sort of start training the patient to work well with you. So you want to remind them that you will be interpreting consecutively in this situation, such as a healthcare situation or any kind of scenario where you are interpreting in the consecutive mode. You need to remind the participants that you do need breaks for interpretation. So you can either coach them to use short sentences or remind them to pause so that you can interpret. After that is transparency. And what is meant by transparency means that you're going to ask the patient to speak directly to their provider as if you were not there. So you're going to be transparent. So you're going to say something like speak directly to the provider. And when you are doing the professional introduction with the provider, you're going to ask the provider to look and speak directly with their patient. You're also going to, again, this is part of that training so that they know what to expect. Let them know that you are going to be using the first person. Now, we already know why we need to use the first person. We know that it's quicker. We know that it is easier to transfer language from one language to another if we keep it in the same tense. But we also need to let the participants know that we will be using the first person so that they know exactly where the information is coming from when you say I or me as you use the first person. And then completeness. So this serves two purposes. This reassures the participants that you are going to interpret everything. You're not going to leave anything out. In working with a professional interpreter, the patient has the power to say whatever they'd like to say without worrying about somebody leaving anything out or changing their words. But the second thing is also reminding the patient that because you will be complete and you will interpret everything accurately as they say it, if there's anything that they don't want the provider to hear or know, then they shouldn't say it because you will be interpreting everything that you hear. Same goes to the provider. Now, the professional introduction, as I mentioned, usually is going to be done with the patient. When you first approach the patient, And of course, because the patient speaks your language of service, for example, Russian, Cantonese, Spanish, etc., that means the professional introduction that you put together for the patient is going to have to be in your language or languages of service. And of course, the professional introduction that you will have with the providers will be in English. So that's one difference between the professional introduction for patient and the one for the provider. The second difference is that it is going to not be necessary to sneak in the confidentiality part, and that's for two reasons. Typically, we want to make this introduction as informative but as concise as possible, because as you already know, interactions in healthcare move very swiftly. They move very quickly. Lots of people are in a hurry. There's a schedule to keep to and lots to do perhaps within the allotted time between the patient and the provider. So one way that we can do that is by excluding something that they already know, which is that if you are working in healthcare, you are responsible for abiding by HIPAA. So the information about confidentiality and how you will keep things private, they already know. So in class, in an exam, in a quiz, in a test, or out in the real world, when you are asked to deliver the complete professional introduction for the patient, it should include all of this information and it should be in the language of service. And when you are asked to deliver the professional introduction for the provider, it should include all of this information except the confidentiality or notes portion. And of course, it should be in English for the providers. Now let's take a look at some examples. Here's the first one.
Hello, my name is Yana. I am an interpreter from ARC and will be the interpreter during your appointment. Before your appointment begins, I'd like to share with you a few details of how I will be interpreting. Everything said during this appointment will be confidential, which means I will not repeat anything that is said or discussed by you or your doctor with anyone. If you see me write anything down, it will be only to help with my accuracy, but I will destroy any notes after your appointment to be sure the information stays in the room. Please look and speak directly at the provider as if I wasn't there. I will interpret in the first person, which means if the doctor says, I will prescribe you this medication, I will say in Spanish, I will prescribe you this medication, instead of saying, he said he will prescribe you this medication. As an interpreter, I am responsible for interpreting everything accurately and completely. Because of that, I'd like to mention two more things. First, please remember to take pauses, often to allow me to interpret. Second, please remember I have to interpret everything. So if there is something you don't want the provider to hear, please don't say it because I would have to interpret it.
Now this one is one that was written by a previous student, and I like it very much, but it is a bit wordy. However, in class, as you study to be an interpreter, I'm going to ask you to do something sort of like this to be sure that you understand all of the information that needs to be included in a professional introduction. Let's take a look at another one.
Hello, my name is Lily. I'm a professional interpreter from the hospital's interpreting department and will be joining you and your provider during your appointment. I will treat everything said by you and your provider during this appointment as confidential. Please speak and ask questions freely, but remember to take pauses to allow me to interpret. Please look and speak directly at the provider. I will interpret in the first person, which means I will interpret everything exactly as you and your provider say it, without saying he said or she said. If you see me take notes, they will be only to help with my accuracy. I will destroy any notes after your appointment to be sure the information remains private. Lastly, I want to mention that I will interpret everything you and the doctor say. So if there's anything you don't want me to interpret, please don't say it.
Okay, the last example we're going to look at is this professional introduction that is a bit shorter. And as I mentioned, a lot of times there will be situations in which you might not have the time to be able to do a pre-session or a professional introduction with a patient or a provider. Now here we're still talking about the professional introduction with the patient. There will be times when, for example, the patient gets called earlier. Maybe you just started addressing the patient and the MA is already calling you back. You should still take a quick moment, either make quick eye contact with the MA and hold a finger up to sort of signal that you need 1 second, or do it as you are walking towards the MA. But you should still take a moment to at least do a quick introduction with the patient if possible. So I wanted to show you this example for 2 reasons. One, because it's nice, short, and concise, and also because it includes another piece of information, which I will point out.
Hi, I'm Huda from the World Languages Agency, and I'll be your interpreter today. I will be interpreting everything you say. I'll keep everything confidential. Please speak to the provider, not to me. Please speak clearly and pause often. If I make this gesture, please pause.
So, for this simple introduction, the last thing that Huda mentions is if I make this gesture and then she raises her hand up, that means that she needs a pause. So she says, if I make this gesture, please pause. And that's also something that you may add if you see it necessary. Now, again, you're going to make this your own. If you, as an interpreter, find yourself in situations through your experiences where lots of patients or providers are not pausing as often as you need them to, then this is something that you might want to add. So that last part is sort of Huda expanding a little bit upon the guideline that asks for short sentences or need for breaks to allow for interpretation. Okay, so now let's take a look at the professional introduction with a provider. Now, again, as I said before, this introduction is going to be done in English. So with the provider, it's going to be in English. With the patient, we said it was going to be in your language or languages of service, whatever language the patient speaks. So I'm going to use this same slide to remind you of all of the guidelines. But of course, I'm going to cross out confidentiality and notes since we mentioned that that's something that we can leave out. So let's take a look at an example.
My name is Yelena. I am an interpreter from ARC Company. I want to quickly share some information with you. I will be using the first person as I interpret. Feel free to speak and look directly at Mr. Petrov as if there was no interpreter. During the appointment, it is my duty to interpret everything that you and the patient say. So if there is something you don't want the patient to hear, please don't say it because I would have to interpret it. Please remember to pause between thoughts to allow me to interpret correctly and accurately. If I need a pause, I will raise my hand like this. Thank you very much.
Okay, so this is a good example of a professional introduction with a provider that includes all of the information and guidelines we said are necessary and excludes confidentiality. But we don't always get the time to be able to do an entire pre-session. And sometimes the providers may not allow you that time that you need. So all professional interpreters need to have a shortened version of the professional introduction ready to deliver to a provider. And here's an example. Hello, doctor. My name is Beatriz, and I am an interpreter for American River College. I ask for you to speak directly to the patient when you speak and speak in short sentences. If I need a break, I will wave my hand like this. Thank you. So I will ask you to write a shortened professional introduction. To do that, you're going to include your name and company. So you're going to identify yourself, and then you're going to pick whatever 2 of these guidelines you think are the most important. So basically, another way of saying this is you're going to do a professional introduction that includes 3 points. So 3 of these guidelines only. One of them has to be your name and the company. So one of them has to be you identifying yourself. And then you're going to pick whatever 2 from the remaining ones you think are the most important. If you could only say 2 things aside from your name to the provider, what are the 2 things you you would want to definitely say to that provider. So again, if we take a look at this example, hello doctor, my name is Beatriz. I am an interpreter for American River College. That's the identifying guideline. And then I ask for you to speak directly to the patient when you speak, and speak in short sentences. If I need a break, I will wave my hand like this, thank you. So in this case, Beatriz, the student, chose to ask the provider to look directly and communicate directly with their patient, and to use short sentences to allow for interpretation, snuck in the information about how she would signal if she needed a break, and that's okay. So, before you finish this course, you should have composed and be able to recite from memory 3 versions of the professional introduction. One with a provider that is complete and in English, one that is shortened with a provider that is in English as well, and a complete professional introduction in your language of service for delivering to patients.